Good afternoon, everybody. We're going to be starting promptly in about 5 minutes. As much as the room is filling up, we're going to be joined by people from the live stream, so we're going to be starting promptly at past. We're going to be using Slido for some interactive sessions today. So if you haven't already scanned the QR code, please scan the QR code. If you cannot get the QR code to scan or work correctly, you can visit slido.com, slido.com, and type in the code. We'll be asking you a series of polls and questions throughout today's session so that you're able to properly interact with all of today's content. All submissions that you send during the entire session to Slido are going to be kept anonymous, so be reassured that anything that you pop in is confidential. Equally, as the session goes on, you'll see that there's a tab for asking us any questions. Feel free to pop any questions into that tab as we're going through, and we'll pick that up at the end of today's session. So we're down to 4 minutes now. The final countdown. We'll be with you shortly.
Hello everyone and welcome to this session. We are personally delighted, first of all, to be back in Perugia after a couple of year wait. My name is John Crowley and I am one half of Headlines Network. My Headlines partner, Hannah Storm, will explain a little bit more about Headlines Network, our work, what we are releasing, what we are publishing today. And I'll also introduce a little bit more Andrew Berrie, who's the national lead for Mind. But first, before we get going, I want to hand over the floor to Matt Cooke from the Google News Initiative. On behalf of Hannah and myself, we really want to thank Matt and Google. Matt, first of all, for his personal support and making this project possible. He also backed a series of workshops that we did last year in the UK. So for a fledgling organisation who are just finding its feet, we are extremely grateful, Matt. Thank you so much. So over to you.
Oh, that's really kind, thank you. So good afternoon and welcome to the session which is entitled Feeling Burnt Out and Broken, which might be a title that seems a hard sell at Perugia, but it's clear from the room being full and all those watching on the live stream as well, there is a real appetite for an honest, open and empowering conversation about mental health. So as John said, my name is Matt Cooke. I'm head of the Google News Lab. My role here is brief. I'm essentially like, remember the paperclip on Microsoft Office that was there at the beginning, then you disappeared it? That's going to happen to me in a moment. I just wanted to be here to personally thank Hannah and John for all the work they've done over the last year and a half, but also just to give a bit more of context about the people that you've got on the panel here who are going to be walking us through this interactive session. So I'll start with Hannah Storm, founder and co-director of the Headlines Network, former director of the International News Safety Institute and the Ethical Journalism Network. And prior to those posts, Hannah spent more than a decade as a journalist at organisations including Reuters and the BBC. In the middle, we have Andrew Berrie, who I hope this is the right job title, we were discussing this a minute ago, is the Mental Health at Work National Lead. Yep. At Mind, the mental health charity. Drew supports the ambitions of Thriving at Work Leadership Council and oversees delivery of the Mental Health at Work website. And finally, John Crowley is a journalist with 25 years of experience managing teams and budgets across a variety of titles. John was a digital editor for the Wall Street Journal in Europe, the Middle East and Africa, and has also previously worked in managerial roles for the Daily Telegraph and Newsweek. He's now a director, as he said, of the Headlines Network, along with Hannah. Just final from me, it was actually in Perugia many years ago, if you remember, Hannah, that we had a brief discussion in the corridor about the importance of a focused effort on mental health when it comes to people working in news and whether they be staff, newsrooms or freelancers. I personally have a connection to mental health. I've lost friends through mental health, and so for the last few years I've had a personal mission, like all of us here on the panel have, to remove the taboo of talking about mental health, particularly when it comes to work. Last year, as John said, we, as part of the Google News Initiative, helped John and Hannah launch Headlines Network, an excellent effort to tackle mental health challenges faced by journalists, providing the tools, forums and resources to access support. I'm pleased to say, I won't give too much away, and hopefully you'll give more details through today. There's some news that we can share about how that work is going forward, and also it's great to have Mind here, who have been really great partners for Headlines Network, so thank you. But as I said, today is a practical workshop promoting our mental health, so I'll hand now to the real experts, and I will elegantly wander off over here, but thank you very much for everything you're doing. Thanks.
Thanks, Matt.
Well, thank you so much, everybody, and thank you again, Matt. And it's interesting that you mentioned that conversation a few years ago. I am so proud to be back here in Perugia. I'm so grateful to be back here in Perugia. 4 years ago, here in Perugia, I hit rock bottom. I was diagnosed with PTSD. I didn't think I was going to make it. And I'm really proud to be back here recovered and being able to share these tips with you today, that we're going to be sharing with you some guidelines. We're going to be talking more about what we can offer. I can feel my palms getting sweaty now, and actually what I've learned in mental health conversations is it's really good to acknowledge that. The point that Matt made about the taboos is so important. I spent years feeling isolated and alone, feeling unable to share my experiences of mental health. Running a journalism safety charity, ironically, not being able to speak about my experiences. So I felt really compelled to set up Headlines Network. Just briefly, John and I we first met here in Perugia actually, but we kept turning up on panels during the pandemic talking about mental health and talking about how do we support our communities in a time that's so difficult. The pandemic's thrown everything upside down and turned everything on its head. And suddenly we came to this moment where, like, look, we've talked enough about it. We actually want to take steps and take action. So this is what today is about. As Matt said, we ran a set of workshops in November, and we're really grateful to him for supporting that. But this is about going beyond that, and we're hoping that what we're launching today is the first industry-wide initiative, working with Mind, the mental health charity based in England and Wales. So we'll be talking you through some of those. So thank you for bearing with me to hear a little bit about my story. But what I would like to share with you now is what we're hoping to offer you today. We hope that by the end of today's session, you should understand why, as journalists, we should all care about this conversation. We hope that you will know where to access useful tools and guidelines. We hope that you'll have a familiarity with different strategies you can adapt and adopt to support your well-being. And we hope that you'll have gained a greater confidence to begin a conversation about mental health in your work.
So just a few guidelines before we get up and running. Just to say, look, some of the subject matter may give you pause to reflect, so just think about that when we're discussing these topics. It's a reminder that this session is being recorded. We should say that the Slido submissions will be anonymous. And one thing that Hannah and I have said at the start, we are not therapists, we're not clinicians. We want to start conversations here, so we want to emphasize that today, that this is a conversation. And ultimately, what we want to do is to create positive connections across the industry, talk to other people who are working in this space, and collaborate with them and do more work. So thank you.
So why do we need to have this conversation now? I think, as I mentioned before, we're all exhausted. Everybody's really tired. It's been a really difficult couple of years. Whenever John and I are talking with people, one of the first things we hear from people is, I'm exhausted, I'm knackered. And on top of all of that's been going on in the last couple of years, we've got other issues that are suddenly coming to the fore. We've got the conflict in Ukraine, and just like to take a moment to pay tribute to all of those colleagues of ours who have lost their lives there, and everybody who is taking incredible risks for their mental health and for their physical health to tell a story that is so complicated and so necessary to be told as well. We've seen issues around racial injustice coming to the fore in the last few years. We've seen issues around those who are most marginalised by our traditionally white, cis male, university-educated media impacting on people much more, and those who are most vulnerable often less able to talk about their mental health in the industry as well. So the pandemic has exacerbated the stresses that we faced as a news organisation, as a news industry, even before the pandemic. Relentless breaking news, misinformation, disinformation, stretched resources, so much going on. As Mark Little, my friend, says, separating the noise from the news. There's been so many stresses. We've had boundaries blurring, the boundaries between our personal lives and our work lives blurring significantly, and that has caused a huge amount of stress and pressure for people. Our work environments have changed. The journalism industry has been forced to reinvent itself over the course of the last couple of years in a way that nobody could have anticipated. What we'd like to take from this, though, is there have been challenges, yes, for sure, but we believe, and we're seeing this, separately from headlines, I facilitate a monthly industry conversation with news organisations about mental health. I've never seen such a commitment to the conversation. I've never seen so many people wanting to prioritise the conversation. There's a long way to go, for sure, but I've never heard so many people actually saying, you know what, I'm struggling too. And yes, we can't always say that all the time, and we can't all say that either, because some of us don't feel able to just yet. But I do feel like there's a sea change afoot, and we're grateful to all of you to be part of that. This is about responding positively, and on that note, we'd like to share with you what we're launching today.
Yes, just to echo what Hannah was saying there was lots of issues that the journalism industry has had to face in terms of stresses, but I think the pandemic, one of the unintended consequences of it is that we can look at, when we come back and look at this subject, we look at it anew, and that we can try and reinvent kind of journalism in a way that really thinks about mental health. So just moving on to the guidelines that, if you can put that up behind me. This is what we're releasing today. It's 2 written illustrative guides. The first, managing our mental health in terms of self-care, which Drew will be speaking about in a second. And the second issue is supporting our colleagues, particularly when support networks in newsrooms are threadbare or even non-existent. A lot of journalists kind of feel that they need to support their colleagues in lots of different ways. So you can find these resources. We've tweeted them out at headlines.net, but you can also find them on our website at headlines-network.com or mind.org.uk/journalism-guides. So without further ado, hoping that the Wi-Fi holds up. we'll hand you over to Drew now.
Good afternoon, everybody, and thank you for joining all of us. Before we dive into some of the real substance of today's session, we wanted to start with an interactive activity and ask you a question that's hopefully fairly straightforward, but for many of us may actually be a complex question. And that question is, how are you doing today? Seems a simple question, but how often do we ask this of ourselves, and how often do we ask this of those that we work with on a daily basis? So using Slido, if you've scanned the QR code or visited the browser, we're going to do a temperature check. So on a scale of 1 to 10, 10 being that you're feeling absolutely fabulous, your best self, and 1 being that you're having a low level of well-being and possibly in need of support, where would you rate yourself on a scale of 1 to 10? So if you're on Slido, you should now have that question posed to you. The answer is going to start appearing on the screen as you type them into your phone. And again, this is often how we start a lot of our agendas and meetings at Mind, and also hundreds of organizations across the UK will start team meetings with a quantitative temperature check. We know that quite often a barrier to having conversations around mental health is not really having the literacy or knowing the words to use to describe how we're feeling. By putting it to a quantitative scale, it makes it a lot easier to share where perhaps on that spectrum of mental health you might be sitting. You might then, put it out a little bit more, be in a place where you feel comfortable with the friends and colleagues that you're with to be able to share what your specific circumstances might be, why you're perhaps feeling a little down, why you're feeling fabulous. And with that in mind, the second question is, what words would you use to describe yourself today? So again, I have already popped in my answers. I'm feeling excited and energized, as you can tell by the enthusiastic voice coming at you via the microphone, and definitely helped by the espressos of Italy. Thank you, coffee shops down the street. So again, we've got those numbers coming in. We've got people that are feeling tired. Perhaps they've been on some early flights. Perhaps they were out at the bar a little late. People feeling inspired by all the fantastic work that's been going on today. People feeling calm. People feeling happy. How about yourself, Hannah? How are you feeling today?
I think I was feeling fulfilled because it's the end of a 4-year journey. So I think that was my one.
Hungover.
That's not a mental health tip, everybody.
Well, I won't comment, but again, it's about understanding what supports your own well-being, as we'll be discussing later today, knowing those activities that bring you joy, that give you peace of mind, that give you space, enable you to really have that work-life balance. So again, it's fantastic to see such a wide range of people feeling positive. And again, with these temperature checks, what we really say whenever we're having these conversations with our colleagues is to think about what is perhaps one activity that you can do by the end of today that's going to move you up maybe half a point on that scale that you just set. And maybe by the end of the week, what's one activity that you can do that's going to move yourself 1 whole point. So perhaps there's colleagues that you've not seen since the last time you were in Perugia a few years ago. Maybe the activity that's going to push you up that half a point or a full point is going to be able to see those friends outside or in the bar or at a meal. Or again, it might be going back to work next week and being able to share all the fantastic stuff that you've learned at the festival. So think about what those kind of simple steps that you perhaps can take that's going to move you slowly up that quantitative scale. But again, having that understanding of where you are, having kind of done a self-audit of where you think you sit on that spectrum, you can then start thinking about how you're really going to bolster your energy and participate in different activities that are going to bolster that well-being. And with that in mind, Hannah's going to give a brief introduction to one of our first guides and some of the fantastic recommendations you can find within it.
Thank you. And I think it's probably really important to note right now that the guides that we're launching today are the first 2 in a series of guides, practical guides we're going to be launching throughout the year. And that tomorrow we're going to be talking about another part of work that we're doing within this Google-funded project, which is going to be training for managers, so support for managers. So I do invite you all to come along to that to hear about how managers can better support their colleagues as well. But without further ado, the first part of our focus on the Managing Our Mental Health guideline talks about some of these different areas. So I'm just going to run through briefly the areas it discusses. And then I'm going to focus a little bit on one specific thing that we know has been very central to people's concerns over the last 2 years or so. So this guide talks about what self-care is. And I say to a lot of people, mental health in English begins with 2 letters, and the 2 letters are me. And often we struggle to prioritize ourselves. Sometimes people use the analogy about the oxygen mask on the plane. You can't do anything to help other people unless you actually help ourselves. And it's really important to give ourselves permission to do that as well. Yes, we want to be there for our colleagues as well, but we also need to be there for ourselves. It talks about what to do in terms of relaxing and reducing stress, the kind of things that you might consider doing, positive things, taking time out and things like that. It talks about how to focus on breathing. There's a brilliant mini exercise that Drew ran us through when we were doing the workshops back in November about how to just give us some focus. So you might be about to rush out the door as a journalist to go and cover a story, and you might be thinking, oh my God, how am I going to do this? This exercise literally takes 90 seconds, and it's a really great moment to reground and regroup and find your center as well. It talks about boundaries, and in a moment I'm going to talk a little bit more about boundaries. It talks about how important connecting with others is, and to John's point about feeling slightly hungover, yesterday was the first time I physically stood with colleagues in 25 months. It has been so important to connect with colleagues, and yet we felt so disconnected as well in some ways in our media industry, and yet at the same time we've been hyper-connected to the news. So we know that in terms of managing our mental health, being able to connect in certain ways with others can be incredibly beneficial. And we also know that looking after our physical health, be that through sleep, through eating healthily, through exercise, is also really, really important. So it talks a little bit about these things. We're not trying to teach you how to suck eggs. We're not trying to teach you how to, live your life, but we're trying to offer some pointers which we know as journalists, having worked in newsrooms for 20 years, work combined with the mental health expertise brought about by Mind. And so just briefly on the boundaries, one of the things we've discovered in the last couple of years, and I'm sure that many of you may have experienced this, is it's often been difficult to separate work from home life. It's often been difficult. So I work from home and have done for the last 2 years or so. My bedroom is 5 meters from my office. I've come up with basically a commute. In fact, John and I both do the same things. We work 250 miles away from each other, but we both do a similar thing where we factor in a commute in our daily life. So we walk outdoors for a certain period of time, and it creates a gap. You know how you used to commute in the olden days, right? You would commute from home to work, and you'd create a gap. And it would give you that space and that mental health space to create the bridge between one life and the other. As I mentioned before, we've been hyper-connected to news, relentless news, reaching for our phone when we're, wanting to be aware of things, doom scrolling in some ways on Twitter, hyper-connected, and yet we are such a sociable industry as journalists. We rely on connections to create our stories. We rely on working with others and amplifying other people's stories. So connection is at the heart of journalism, and yet we have been disconnected. And that's a really difficult thing. So that's the kind of boundaries that we're talking about there. On that clear signals that I mentioned before, the commute as well, it's really important to try to find a way to create those boundaries between the work and the home life. It's often really difficult to separate yourself from your phone, for instance, as well. And, one of the things we do is we try to create what we call friction as well in terms of the way we use our technology. So perhaps we take the notifications off, so it makes it slightly harder, or we take the apps off our phone, so it makes it slightly harder for us to reach for that. Or we say, look, for 10 minutes, I'm not going to use my phone today. That can be really hard. And protecting our personal time is really important too, right? It's really hard and it's really easy to slip into, I'm just going to spend 10 more minutes doing this. But actually, when our lives are already blurred, protecting the personal time is super duper important. So I try to go downstairs in my house to have my lunch downstairs away from my desk. I try to make sure that I have a moment where I really connect with my children, or more than a moment, connect with my children after their school day to ask how they are. And I try to kind of find time within my working day where perhaps I might have had a coffee with a colleague to do something for me, whether it's just popping outside and walking around the garden or something else, protecting that time. I also stick in my calendar meetings with Hannah, which might sound a bit weird, but actually it's really beneficial. And I think that the other thing that I just wanted to flag is I was fortunate to do some work with somebody called Mark Abra, who many of you may know. She runs the Self-Investigation. She's a wonderful journalist, and Kim Bryce. And they were talking to me about kind of contracts and conversations you have within your work teams about how do you establish the boundaries around communication. So it's really important in terms of the boundaries that it's not just boundaries for ourselves, it's boundaries about how do we work together effectively. What platforms are we using to communicate? How do we communicate in an urgent manner? What are the moments in our lives that actually we don't want people to invade, as it were, and to have that kind of conversation ongoing about how we manage that. So that's a focus on boundaries. It's a key part of our lives. And I think where we can create those boundaries and learn and actually give ourselves permission to say no. Sometimes it can be really hard to say no, but actually it's incredibly liberating as well.
But we all know that we're all different humans. What supports one person doesn't support everyone, doesn't support all of our colleagues. And we equally know that there's been a real strength in sharing what works for us with our colleagues, with our friends, and learning from one another, particularly over the period of the pandemic. So again, if you have your Slido on your phone, we're asking you to please share what are the activities that have supported your well-being and self-care over the last 2 years. So if you want to pop that in, make sure you press the submit button. Again, we've got people suggesting the gym and running. Again, a large number of people, particularly during the pandemic, when you had limited amounts of time when you were perhaps able to go outside, really found that exercise was a real joy to them. It gave them a degree of routine. It also sometimes gave them a challenge to work towards. So they were wanting to have a certain personal best, or they wanted to run a certain number of miles. You know, finding an activity that has an element of achievement and reward to it is a really good coping strategy for boosting your well-being. Again, we've got a number of people that look at podcasts, look at audiobooks. Again, these are ways in which they're able to kind of set themselves apart from the world and really get engrossed into a new piece of information or learn a new skill or kind of delve into a whole new fictional world. Again, we've got people watching TV shows, making coffee. I 100% agree with that individual. Intentionally looking around me. Again, you know, during the pandemic, how many of us discovered new neighborhoods or new areas around our homes that we'd never really walked past? It never formed part of our commute. I remember finding a fantastic app where you could put in the number of miles that you wanted to walk, and it would just create a random route for you using maps. And again, that was fantastic for me to be able to get off the beaten path and again, be able to really get away from what was really troubling me or concerning me.
There's a cat there.
My cat.
Yeah, we've got pets and cats. Again, a large amount of people that are very much engaged with a new hobby. So again, we've got cooking, writing, drawing, painting, a whole host of things. And again, we need to remember that not all of these things need to be large and substantial things. Someone's put showering. And again, you know, there were definitely points in the pandemic at which getting out of bed was definitely a supportive activity. And actually, you know, having some of those elements of routine in terms of, you know, I'm going to put on clothes that are not just sweatpants, and I'm going to have a shower, and I'm going to do my hair. You know, those are small, little activities that for many of us can sometimes feel like quite large, insurmountable mountains if we've got a period of particularly poor mental health. So again, when you're thinking about some of these different activities that are able to support your health, again, do think of that full gamut. Again, these have been submitted confidentially, but we can share some of these kind of anonymous, summarized findings through the Headlines Network Twitter account. So we'll look to share those with you later. But we're now going to jump into thinking about stress, pressure, how we can manage our stress. What does stress even mean? And so we're going to start with a video, which through the power of hopeful Wi-Fi will work.
The following graph illustrates the relationship between pressure and performance. With little or no pressure on us, we can experience boredom. This can lead to very low or poor performance. As pressure on us increases, our performance can also increase. And there is a period where we might feel like we're in our comfort zone. If we move from our comfort zone and begin feeling stretched, this is the zone where we can achieve maximum performance. You are more energized and focused and ready to meet new challenges. But it is unrealistic to think that you can remain in this zone indefinitely. You need to recharge your batteries in the comfort zone to sustain your performance longer term. However, if you're unable to recharge your battery and the pressure continues to grow, the pressure will have a debilitating effect. We move towards experiencing strain, where we begin to falter. The increased pressure can impact the way we perform by affecting our concentration, our decision-making abilities, and our effectiveness. When it is experienced at a very high level for prolonged periods of time, this can place great strain on us. If we continue to experience this strain, we can reach a point at which we believe the pressure is unmanageable and our performance deteriorates, meaning we reach a point of crisis. This often means the pressure being applied or perceived has exceeded our capacity to perform and exceeded reasonable performance levels. Long-term exposure to this level of pressure can lead to stress, which can both cause and worsen existing mental health problems. Therefore, recognizing when the pressure is too great is key to being able to do something about it. For example, taking a break, having some time out, or speaking to your manager and trusted colleagues for support. It is always okay to ask for help.
And again, that's really just to underscore that pressure can be a fantastic thing. I imagine a large number of people in this room and in the industry thrive under the pressure and the challenge of the different briefs and assignments that you're all set. But when that goes unchecked and it continues to build, that's when you go into that period of strain, and that's when you begin to experience stress. And that can really manifest itself in a number of different ways, whether that is panic or anxiety, distancing yourself from others, distancing yourself from your work. It manifests itself in a whole number of new ways for us. And again, that point of crisis is really at which that then becomes utterly unmanageable. And that point of crisis is what we then refer to as being called burnout, which again, I'm sure is a phrase that a lot of us have used far more in the last 2 years than perhaps ever before. And that's when, again, you begin to emotionally distance yourself perhaps from the work and from those around you. And again, you feel kind of lost, hopeless, and feel disconnected from everything, which can include yourself. So we're going to start thinking about what we can do to address some of those sources of stress. And again, having an understanding of what kind of activities you can look to put in place really then stems from identifying what are some of those sources of stress. So again, we're asking you on Slido, if you're happy to, and again, reminding you that it is confidential, to please share some of those sources of stress or triggers of poor mental health that you experience yourself. And again, these can be a large number of things. Again, it can just be a buildup of pressure. It doesn't need to be any particular activity. It can just be the quantity of things that you feel that you have to undertake. It can be big changes. And again, those changes could be external to your environment. So it could be things like the pandemic that we've all been experiencing. It can be things in your family or your home life. Or it can be things at work. Again, a large number of us have been going through sweeping change management processes in our workplaces. So it can be a whole host of different ways that change happens. It can just be worry about something, which may be out of your control or within your control. It might be, again, just that sense of control that you might have, whether or not that's the quality of outputs, having a say in the work that you're being assessed, the deadlines that perhaps you've been provided, but not feeling that you're able to have that conversation perhaps with a line manager. And it can be the actual activity that you're undertaking. You might not feel inspired by the work that you're being provided. And again, that can also be a source of stress.
I think it's just worth picking up on the graphic content point there. We're seeing a lot of people struggling at the moment with the risk and threat of vicarious trauma from seeing images and having to manage that as well. And I think that's a really important point to note for people, that people are struggling with that at the moment.
Absolutely. And again, here, taking a look at some of your submissions that are coming through, we can see high workload is the number one. I can tell you that certainly within the UK, that is the number one cause of stress. 60% of all stress in a workplace setting, people attribute to the quantity of workload that they've been provided. Again, sometimes that's due to the specific brief. Sometimes that's due to the actual deadline that's being provided. But in most cases, it's because it's been very much dictated by a manager without any element of negotiation. So again, perhaps the scale of work is possible, but not within the timeline that you've been set. And given a particular timeline, you can deliver on a particular piece of work, but perhaps not to the quality standards or to the scale at which has been discussed. And a lot of managers don't necessarily yet understand that that really needs to be a two-way conversation to be able to deliver the work, but but deliver it in a way that is psychosocially safe for everybody in the workplace.
And this is a big issue in our industry. There's a couple of ones there: unempathetic news editors, pressure from managers, and so forth. It's a big problem. And Hannah spoke about this earlier about the panel that we're doing tomorrow, which is particularly around news leadership as well, which we'll be speaking to.
Fabulous. So thank you for sharing all of those. And again, we'll look to share some of those through the Headlines Twitter account. We're going to move on to thinking about how do you manage this. So again, your first step is really identifying what are some of these sources of stress that you have in your life. Again, you're able to reflect on that yourself. It might be a discussion that you have with a colleague or a discussion that you have with a line manager or an editor. But hopefully you've begun to think about some of those things through the exercise that we've just undertaken just now. And again, from that point, you're then able to consider what are some of the mitigating circumstances that I can perhaps do proactively that are going to prevent a particular situation occurring or lessen the impact of a particular circumstance occurring, or how do you react? So if it is something that is not within your control and there is a percentage or a likelihood that such an occurrence will occur at some point in time, what are perhaps the things that you can put in place or you can share with a colleague or a friend or a family member or a line manager or an editor and say, actually, at these points in time, that's when I need support, and if you see these signs, this is perhaps when I need you to step in and lend that helping hand. Having identified those triggers, you can also think about how you organize your time. Again, thinking about high workload specifically being a high cause of stress. Just organizing your time can be really beneficial. So thinking about your own energy over the course of a day. When do you have high levels of concentration? When do you have high mood? And when do you have low mood? And kind of managing your diary around those different personal circumstances to yourself. And perhaps sharing some of those, again, with line managers and colleagues so they know how to best work with you. Making a list of things that you have to do and prioritizing them. It seems like a very simple thing to do, but just brain dumping everything that needs to do, prioritizing it, and then scheduling it in your diary, protecting it, and making sure that you've got a clear source of steps of what needs to be delivered. Again, giving yourself achievable targets so that you feel that you're actually making some progress against these activities. And equally, if these are well-being activities versus kind of work activities that you're looking to do, and you're trying to form some of those healthy habits, there's a fantastic book called Atomic Habits, which I 100% recommend people to read. But it also talks about habit stacking and how you link routine and things that you already do with things that you want to achieve. So how can you link going to the gym with your already existing commute? Or saying, after I've showered and gotten changed, I am then going to do 5 sit-ups. And linking kind of existing activities that you do to things that you do every single day. And kind of supporting yourself to do that. Equally, it talks a whole number of different strategies in terms of kind of rewarding yourself. So if I want to access Instagram, I need to do 10 press-ups in order to access social media. And it's a good way of acknowledging that perhaps there are some behaviors that you want to cut down, and there are some behaviors that you want to increase. And by linking the two, you're able to come to kind of a mutually beneficial position where actually you need to work for some of those bad behaviors, but equally you're rewarded by them.
That's Atomic Habits. Atomic Habits by James Clear.
Correct.
And we don't get any money from him, don't worry.
Yes, we have no referral traffic, unfortunately. And again, the last point is then really addressing those root causes. And again, that's thinking about, if it is high workload, if it is difficult conversations with manager, if it is change and just needing to know what is the work or what is my pipeline of content that I've coming up, establishing what some of those causes are and having those proactive conversations with your editor, with your sub-editor, with your colleagues, and trying to put in some mitigating actions. We do also have to acknowledge that, again, there are some things that are outside of our control. This diagram is called the spheres of influence, and it very much says focus your attention, focus your efforts on that which is within your control, and make a plan for it. There's things that you can influence, so again, some of those kind of manager conversations that we were just referring to, have those open and honest conversations with those within your workplace, and then accept that there are things that you can't control. You cannot control a pandemic happening, and you cannot control your particular government's response to that pandemic. And you need to try and actively let go and appreciate that worrying, stressing, trying to think about what you may or may not do in half a dozen different contingency situations is not necessarily going to be beneficial to your mental health or well-being, and just try to actively let go of some of those things. And we were talking about this the other day and thinking about some examples that we could use for how we might put this to life. And we were thinking about when you're getting emails all the time outside of regular hours or late hours. So if I was an employee or a journalist, I may be getting emails from my editor at 10 o'clock at night, 11 o'clock at night. It's constant and bombarding. I can think about what I can control in this situation. So I can say, well, I'm going to set my boundaries and I'm going to try step away from my laptop and my computer at 6 o'clock, and that's me stepping away and setting a clear boundary and demarking the day. On my phone, I'm going to manage my notifications. But I cannot control my manager actually sending those emails. I can maybe have conversations. So in that influencing space, I could have a conversation with a manager. And I think Hannah had a few ideas, and John had a few ideas of what editors could perhaps do in those circumstances.
Well, those conversations can be obviously awkward with an editor, but actually there was one news editor who actually attended our workshop last year, and they would say, yes, I work late, that's my decision. But they said, well, I'm actually going to send the emails to hit your inbox at 9:30 the next morning rather than 11 o'clock at night. It's just thinking about those things, about what you can do. If you've got a good relationship with your line manager, perhaps you can say that. We realise that's awkward because, sometimes if you put these points forward, you could be seen as being querulous or, just trying to make a point. But it's just about thinking holistically in the round.
Absolutely. And something that we're seeing outside of the journalism sector, increasingly at the minute as a lot of workplaces transition to hybrid working, is little lines and email signatures as well, which very much kind of says, I'm working the hours that best suit me. I expect you to be doing 100% the same, and I appreciate that these hours are not the same hours. And again, that just sets that expectation to the receiver that you're not expecting an immediate response.
And just to add there's something you can do in Slack where you can say, I'm at lunch, I'm away, I'm off today. And, there's a lot of enlightened places where, again, this is coming from newsroom leaders. They're doing it themselves and they're encouraging their staff to do it as well.
So that's just a bit of an example of what is within your control in a certain situation, what perhaps could you influence or begin a conversation with a manager. And again, examples of what you can control. Obviously, you can't control breaking news. So again, there are still going to be circumstances in which breaking news occurs, those emails do come to you. And again, in such...
Yeah, but you can control. We can't control the news coming from Ukraine, for instance, but we can control the way we consume it and absorb it. So I was just very briefly had a conversation a few months ago with somebody who was the bureau chief of a big organization, and this person said to me, well, I absolutely expect every single member of my staff to have their phone by their bed throughout the night. And I said to this person, but in the olden days people were on call, and one or two people were on call. Not everybody was on call. And we were able to kind of, this person didn't quite get it still, unfortunately, but other people within the conversation did. And it's really important, I think, to recognize that we have to be able to take space and time out. And sometimes it's hard to cut the umbilical cord. It really is. But just trying little steps, I think, is something we can control. And if you have a day where it all goes pear-shaped, don't think that you've completely failed, because you haven't. It's just been a bad day, and then the next day you can start again.
Remembering to switch my microphone on. So obviously everything that we've just spoken about, somewhat academic. If you're looking to put this into practice, there's a fabulous tool called a wellness action plan, which will hopefully appear on the screen behind me. And a wellness action plan is a really simple tool that asks you a number of the questions that I've just asked. And you can do it as a collaborative exercise with yourself and your line reports, yourself and your colleagues. You can do it with yourself and your editor or your line manager, or it can just be a self-reflective exercise that you look to do yourself. But again, it's thinking about what are those positive things that support me have a fantastic experience at work? What are some of those triggers of poor mental health and well-being? And what are some of those warning signs that perhaps I want friends or colleagues or family members or my editor or manager to look out for? How does that impact performance, which is perhaps what my editor is going to notice? So if I know that it usually means I'm not coming in on time, I'm late, I'm tired, I have increased errors, those are the kind of things that usually objectively they can see in your work. So again, that gives them something really tangible to look out for. Steps that you want your line manager to take, so when they notice these things, what do you want them to do? Do you want them to have a conversation with you on Zoom, in person? Do you just want to send an email, have it highlighted? It's a bit of an instruction guide for your line manager in terms of the next steps that you want them to take. And then equally, thinking about proactively, what are the steps that you yourself can take, just as we've been talking about earlier. Proactively, reactively, what are the things that you are going to take responsibility for yourself in this particular situation?
And just to pick up on that, I think thinking about that in advance, thinking about that in advance before you start feeling low is really important. So you've got something to come back to in a moment where you're actually thought about that beforehand. So this is kind of a template I'm going to use to help support me.
Those are available from the Mind website, so mind.org.uk/WAPS, W-A-P-S, no relation to the Rude song. You'll find a series of templates. We've got one for people working remotely, one for people that are entirely working in a physical workplace, and one for people that are working in a hybrid fashion. Again, appreciating that some of those signs might be different in those different environments, and equally, the people that you might want to involve or the people that might notice some of those signs and behaviors are going to change depending on those different environments.
Just to say here in the Slido app, you can start submitting questions. We've got some already, but if you have any questions for Hannah, Drew, and myself at the end, please start doing them now. The second illustrative guide that Hannah, Drew, and myself worked on was supporting colleagues. And this looks at how you can spot the signs of poor mental health, how to start a conversation. On one of our workshops, we had a manager who was saying, I have good mental health, but I have no idea how to start a conversation with my team. There's signposting to support. And what we also did as well, on top of these guides, was we actually spoke to colleagues in the journalism industry. So we've got 2 animated videos that we have shared on headlines.net, and we're going to show one of them now, the supporting colleagues one.
I'd say the main thing that worked in terms of support from my colleagues was having time. I wasn't pressured to feel better or ready to work when I have been in a difficult place. Working through that can be a particularly difficult period. It can be a long process. It's not something that you can rush and never should be rushed.
I think sometimes it helps to start a conversation about mental health if you talk about your own mental health first. Talking about your own mental health demonstrates to other people that it's safe, it's okay for them to talk about theirs, and that you're somebody who will have empathy, you will listen.
Just telling people all the time how important it is to speak up, either to open up about their own issues and find someone to talk to, or tell someone about someone else they're worried about.
Empathy, and then trying to be that listening ear, properly constructively listening, not rushing to solutions, maybe explaining things that have helped you cope, and then enabling that person to process that in their own time.
Thing that really kind of is helpful when supporting colleagues is to recognize when that colleague is behaving in a way that's different from what might be their normal.
You can never make presumptions when it comes to mental health. Everybody's different and everybody's individual and unique in the way that they deal with their own mental health. But what you can do, and what I've been trying to do, is just engage in conversation. And those very simple words, that very simple phrase, "Are you okay?" I think makes such a huge difference. And cake has often been a big support to me in mental health times, if I'm perfectly frank with you. Having tea and cake makes a huge difference. And having someone to have tea and cake with makes an even bigger difference.
I have this standing arrangement that I open up a hangout at 12 o'clock every day, and anyone who wants to come and talk to me about anything, maybe 2 or 3 will turn up. Knowing that there's something that they may want to share, I'll ask a question that would allow them, that draw out that information if they want to share it.
I think they can largely be distilled into, say, 3 key things. Listening is the first and foremost one, being there as an open ear, supporting them in any way that you possibly can do in a practical sense, and then signposting. I think really trying to understand what a person's going through, let them lead the conversation, do any of the immediate things that they may need to get support. But then again, it's then signposting them to the relevant professional support or appropriate support.
Peers they could talk to, actually their own colleagues, some of whom were trained as mental health advisors or peer-to-peer supporters, to colleagues they could go to talk to.
There might even be like a mental health champion scheme in the workplace. There might be regular well-being sessions. For me, the ones that really work might be the places that have those, but also the culture is centered around people, or you just get the sense that decisions are made with people's well-being in mind.
Headlines Network exists to create environments where everyone in our journalism industry feels safe to acknowledge, support, and achieve good mental health at work. We have worked with the mental health charity Mind to bring you this video. This project
Just skip past the shameless self-promotion at the end of the video. We're all shameless self-promoters. We're proud of it. And we know the guides are going to do some good work. Again, that guide incorporates a vast amount of guidance on how you can support a colleague in terms of those early signs to spot out, how to approach that conversation with some broad principles, signposting to wellness action plans, again, where you can signpost information. We're going to just cover off very briefly some of these broad principles to how you might approach a conversation. And the first is finding an appropriate place. And again, appreciating that people are going to have different levels of comfort around possibly having a conversation around mental health in their workplace. So you're perhaps going to want to try find a quiet space, a meeting room, away from a newsroom floor.
Yeah, there have been instances where conversations have been started right in the middle of a newsroom, which is clearly a no-no.
And also if you're working remotely, how do you have the conversation remotely, right? Is there a particular moment?
Exactly. And again, if you're wanting to have those conversations and people are working remotely, perhaps you're wanting to try give them some notice. They're maybe not wanting, if they're sharing a dining room with kids or family members or partners or flatmates, they're perhaps not wanting to have that conversation in that space. So it's being considerate around when is the right time and how do I make sure that I'm creating an environment in which that person feels the most comfortable to have that open and honest conversation with you. The second element is to encourage the person to talk to you by asking open, non-judgmental questions, which I expect all the fabulous journalists in the room already know how to do. But also not to make any assumptions. And again, you might have had your own experience of mental health. You may have managed people that have their own experience of mental health previously. Perhaps you've supported them gain help or seek treatment or seek a medical professional. Again, we all have our very own unique experiences of mental health, and different things work for each of us in very different ways. So again, you're going to want to make sure that you're not making any assumptions that what's worked for a previous colleague is going to work for this colleague. You really, with that in mind, need to listen and respond. So actively listen to what they're saying, give them the space to have that open and honest conversation. Don't feel the need that you have to say something or fill in any kind of silence with your own words. And ask them, what do they want to do? What are the next steps that they feel that they need to take? What are the steps that they feel they can't take currently? Be honest and clear around what level of support you can provide. Again, we're not trained clinical professionals. The vast majority of you are not going to be trained clinical professionals. So be honest and clear around what support you can provide, but also be honest and clear around whether or not something's actually prompted you to have this conversation. Have you spotted some of those signs of poor mental health and actually you have a concern for that colleague? If so, be open that that's actually why you're initiating this conversation, because you have a concern. Equally, if you're a line manager and you're kind of doing it in a more professional capacity, if it's their performance that you've noticed, make sure that you're really clear around that element of performance that's fitting into this conversation as well. Make sure that you ensure confidentiality and that what is shared in that space is safely going to be kept in that room, that you're not going to share it with anyone else. And again, then look to develop that action plan. So the similar wellness action plan is a fantastic tool to then do with a line manager, with a colleague, in terms of what those next steps might be. Signpost them to support, so the relevant healthcare infrastructure that exists within your own countries, or again, any healthcare or insurance options that are perhaps available through your employer. Signpost them to all the fantastic support available. Again, if you don't know where to signpost, the resources that we produced have journalist-specific and UK-specific signposting advice for where you can send your colleagues to. And again, seek advice for yourself, perhaps. Maybe you've not fully understood everything that's been discussed and you want to upskill yourself. So perhaps you want to visit the Mind website or visit a similar website to kind of understand some of the terms that have been used. Equally, you might want to seek HR or occupational health, and again, perhaps upskill yourself in terms of what your organization has available. So again, don't look past the fact that you need to perhaps seek advice and guidance for yourself. And then lastly, just reassure them that you're there. Again, we had the question, are you okay, posed in the video. In the UK, the average person says, I'm fine 14 times a day. How often do we say I'm fine and it's not really true? And again, perhaps it just takes, the opportunity to remind them that you're available or the space to have that conversation. They might not be able or ready to have that conversation when you first approach them, but knowing that you're there to listen means that actually, perhaps in a week's time, in a couple of days' time, they're going to feel actually they have the confidence to have that conversation. So reassure them that you are available and how they can get in contact with you.
Just on the second from last one, seek advice and support for yourself. There's lots of newsroom managers who are doing the checking in, who are being extremely diligent and empathetic, and no one's checking in on them, and that's a really important point to make. Hannah and I, haven't we? We've heard so many people are struggling.
Many people feel very squeezed, very stuck in kind of pulled from each side, basically, and squeezed at the same time, which is a bit of a weird concept. But just a couple of things there. On the resources, there are links to, it's not a completely comprehensive set of links, but to organisations that do offer some degree of support in some spaces. I think the other thing that's really important to note is that, to Drew's point about, are you okay? Sometimes it's helpful to say, are you okay? Are you really okay? To ask that question twice, because actually it can be that moment where the person kind of goes, actually, I'm not. Even if you say I'm fine the first time, then I'm not. And then to Drew's final point there, I think it's really important. One of the things we know from mental health and journalism, and one of the things that I personally struggled with myself, was feeling like speaking out about my mental health would impact my career, would impact my reputation. And so we're having a conversation with somebody as a colleague, or if you're a line manager, just being able to support that person and say, look, it's really important, and we'll talk more about this tomorrow at the panel, it's really important that we create this space, but actually know that this is not going to impact your reputation. That's a really, really important thing to say.
So we've got a little under 10 minutes of questions. You can see that they've been coming in there. Let's start with, and we'll put this both to Hannah and Drew. What specific measures can I take to protect myself from covering traumatic stories?
I'll pick up on that if that's okay. And I'd like to point you, I could talk about this for a long time, having experienced vicarious trauma myself in 2003 after the bombing of Baghdad. It's very important to me, this conversation. I did some resources for the Reuters Institute. There's an article on the Reuters Institute about some of those. Also journalism.co.uk. We'll retweet these after, and Press Gazette. But a couple of things very, very briefly. Vicarious trauma has, or the graphic content has often been described as toxic material. So treat it like toxic material. Minimize your time spent with it. Minimize the size that you see it on. So if you can see it small as possible, take breaks from it. Establish some kind of relationship with, so say you're the manager, you need to set the terms and actually don't ask somebody to do something that you wouldn't do yourself. Take breaks away, as I said, and understand the kind of context within which you exist, because you're doing something which comes from a long way away and you're existing in another environment. So sometimes that separation can cause a degree of stress that is different from if you were on the ground covering it as well. And I think just one final point there is, we know when we do receive validation for our work as journalists, we know when we're told, this is a really important job you're doing, thank you so much for doing this, that makes a huge amount of difference to our mental health. So if we're working with colleagues, or if we're managing somebody and they're doing that, thank them. I think that's really important to say.
Just saying thank you. Let's move on to a few more questions. To tier one, what signs of poor mental health should I look out for in a friend or colleague? And I'd love to get some advice on how to support colleagues dealing with or recovering from burnout.
Sure. So again, we've covered a few of these elements throughout today's session. And again, the number one thing to underscore, again, is that we're all unique and we all have our own experiences of mental health, and that's going to manifest itself in different ways. So there's a number of different signs that you're going to want to look out for. And again, the guide has a number of physical, behavioral, and those that are specific to the workplace that you can find in our new guide. But ultimately, you're wanting to try and see where someone that you know well is beginning to behave or act differently to a manner than you know that they typically do. So someone that's normally outgoing, chatty, friendly, always contributing in meetings, becoming more withdrawn, more quiet, not feeling that they can contribute in meetings, that's perhaps a sign that someone is experiencing poor mental health or well-being. Equally, someone might be struggling with day-to-day activities. So we were talking about, getting up, showering, put ourselves together. those might be signs that actually someone is experiencing poor mental health at a particular point in time. And interestingly, yesterday I said actually I had to particularly highlight this was not a cause of poor mental health amongst myself, because typically if I don't put foundation on my face, that would have been a sign of poor mental health. And during the pandemic, I actually had to reset some of those kind of signs and symptoms with my manager and say, actually, don't be concerned if you see that, because I'm in my bedroom and I'm not putting on foundation.
I think it's also important to note, Drew, as well, that actually sometimes it's harder, or it has been harder when we're working remotely to spot some of those signs as well. So I think that's an important point to underscore.
Another two-tier question: how best to support undergraduate students studying journalism to prepare them for working life? And that's combined with the question, why are so many young people suffering with bad mental health?
Do you want to do a second, Ben? I'll do
Yeah.
the first.
Yeah.
Yeah,
You go with the first bit.
So I think that, just remind me of the question again.
How best to support undergraduate students studying journalism to prepare them?
I think it's a really important question, and I don't think that many journalism schools integrate conversations around mental health into their syllabus sufficiently, or conversations around safety as well. I think it's a really important thing that we start doing. I'm really reassured, though, that journalism students generally, and younger people generally, early career journalists, seem to be more literate in many ways to be able to speak about their mental health than many colleagues perhaps of a different generation. So I think that's reassuring. But I think normalising at any age and stage of your career, normalising conversation and being able to say to somebody, it's okay to not be okay, and it's really okay to ask for help when you feel ready to do so, is important.
Absolutely. And equally on that point, Mind has had a universities program which has entirely been about that transition from university through to early careers, that we ran a pilot with 10 universities in the UK. There's a lot of really good resources and findings that are specific to a university student audience, not journalism specifically, but again, definitely worth visiting on the Mind website if you're looking for any resources that you can perhaps share with some of those young people. In terms of why we're seeing a prevalence being so high amongst young people, I would agree that actually a large number of people have greater levels of mental health literacy and feel more comfortable having some of these conversations around mental health. So I will also caveat that there is a degree to which we think actually young people are more likely to disclose that they might be experiencing poor mental health, and that is a small element to play here. But I think particularly over the last 3 years, and what we see in a lot of our findings is that they have no sense of hope. If I'm to put one broad point here, the pandemic, climate change, again, the news narrative, a lot of young people don't feel that they actually have hope for the future. There was a piece of research that was done by the City Mental Health Alliance about early careers young people in the UK. And again, climate change was the third biggest driver of poor mental health amongst young people. And that might seem like a ridiculous overreaction, but that is how young people feel. And it's really, suggestive of the fact that they have no hope for that future. Again, they know a number of things that might be of support to them, but they don't necessarily feel that they've got the tools or the control or the authority to be able to put some of those steps in place. Sometimes they have teachers or professors that don't have the time to commit to provide them some of that support. And again, a lot of those structures that sometimes exist, they feel listened to in the moment, but then they don't see anything change. So you can discuss an action, but then no action occurs. The issue isn't fully addressed. And I think all of these things, we're not going to solve young people's mental health in these 2 minutes, but it's a number of different factors at play here.
Last two-tier question. How to set boundaries in an office environment where everyone else seems to find it normal for there not to be boundaries, and what to do when you consistently mention employee well-being to your news editor, but they bat it away, saying we don't have time to slow down. I guess I can get a shameless plug in for our talk tomorrow, Are You Managing Well? How to Start a Mental Conversation, which starts at 5. But Hannah, do you want to take that one on?
I mean, and actually I think hopefully the first part has been addressed somewhat in some of the things we've said already, but the second part is I strongly believe that unless we invest in the well-being of journalists, if we don't invest in the well-being of journalists, we're not investing in the well-being of journalism. I think we're not going to have a sustainable journalism unless we look after the people who create the journalism, and journalism does not exist without journalists. So I think that it's really important it's an icky subject, but it's about the bottom line as well as the headline. Okay, so it's about the money that you're losing and the people you're losing potentially if you don't invest in that conversation. And I think that's probably us out of time, isn't it? But thank you to everybody for being here today, for your time, your patience, your commitment and your interactivity, if that's a word. And once again, thank you so much to Matt and to Google News Initiative for supporting us, and to Drew for your support.
Thank you, Drew. Have a good day, everyone.